आज मुझे गर्व है कि गांधी जी के दिखाए मार्ग पर चलते हुए 125 करोड़ भारतवासियों ने स्वच्छ भारत अभियान को दुनिया का सबसे बड़ा जन आंदोलन बना दिया है।
In October 2018, the Government of India organized the Mahatma Gandhi International Sanitation Convention. It marked the beginning of the 150th birth anniversary celebrations of Mahatma Gandhi and celebrated the achievements of Swachh Bharat Mission, which was launched on 2nd October 2014 by Prime Minister Narendra Modi with the goal of realizing an open defecation-free India by October 2019. Representatives from 70 countries, of which 55 were ministers, including Nigeria's Minister of Water Resources, attended the convention and exchanged experiences and ideas about how to create universal access to equitable sanitation. It was during the convention where the idea of a South-South cooperation between Nigeria and India was conceptualized.
The kind of work which has been done here and learn from this and maybe apply in their context. In that way, I think it would be quite useful and they can adopt themselves to achieve the elimination of open defecation in Nigeria.
Government of India extended their invitation to the Government of Nigeria, and I think this is a very good exposure to them and to the Indians also, to understand how the people from outside look at our program and what are the things that we can give to the world about the sanitation program.
The two governments, with the support of UNICEF, World Bank and WaterAid, arranged a study mission for Nigerian delegation to India to give them an exposure on the various elements of Swachh Bharat Mission. India and Nigeria share many similarities and also challenges that are related to equitable access to safe sanitation and hygiene.
It's very important for these two countries, Nigeria and India, to exchange their insights because they are struggling with the same challenges when it comes to having a federal government implementing a national program.
According to the joint monitoring program of UNICEF and WHO, Nigeria had 47 million people who were practicing open defecation in 2015, which contributed to approximately 60,000 children under the age of 5 dying each year due to diseases caused due to poor water, sanitation and hygiene services. That same year, India had a whopping 524 million people practicing open defecation and about 117,000 children under 5 dying each year due to water and sanitation-related diarrheal disease. Under the Swachh Bharat Mission, India had been able to exponentially increase sanitation coverage in rural areas from 39% in 2014 to 98% in early 2019.
The usage of toilets, which is about behavior, is over 90%. So it's not just about constructing toilets, it's about usage. Today, out of those 600,000 villages, about 550,000 are open defecation free, and 28 out of those 35 states and union territories are open defecation free. So there's been a big shift.
The objective was not to build toilets. The objective was to make India open defecation free. So in some sense there was a recognition of the fact that it's not enough to build toilets, you have to also change behaviors in some way.
The study mission commenced with bilateral and interactive sessions with key government officials at the Ministry of Drinking Water and Sanitation, Ministry of Panchayati Raj, and representatives of UNICEF, World Bank and WaterAid.
This is the third milestone with a study tour with 30 dignitaries and technicians from Nigeria coming to learn at central level, in the states, at the district level, in the blocks and in the village, to see step by step how this was operationalized and also how to have such a political drive, how to do monitoring system, how to fund such a large-scale campaign.
They covered topics from the fundamentals of Swachh Bharat and financing of rural operations to the crucial role of monitoring and community motivators. All of the sessions highlighted the importance of investing in capacity development and localized behavior change messaging to ensure that the results were sustained. To gain insights on how theory had been translated into action under the Swachh Bharat mission, the delegation visited Hazaribagh district in India's eastern state of Jharkhand, where they were immersed in the state's unique culture and were able to pay visits to local health centers, schools and individual household structures to observe how the sanitation movement has become everyone's business in India. The visit celebrated the role of community participation and gender empowerment, as Jharkhand had trained over 55,000 women to become masons or Rani Mistris, supporting toilet construction.
In Jharkhand, we found out solutions by community mobilization and community involvement.
People representative of Panchayati Raj institutions, the VWSCs, Swakshagrahis, the Jal Sahiya. So these are the people who have led this program in all the villages.
The delegation from Nigeria will take what it has witnessed in India back home and will be able to implement the learnings in their own sanitation program.
We learn a lot about India's success in respect to sanitation and how they were able to reduce or improve their open defecation-free coverage.
We were also able to visit communities, to visit the districts, and we saw a system working.
If Indians can take 550 million people out of open defecation, we should be able to do that if we are able to put the same commitment, the leadership, and all that we're going to learn in the course of this study tour into action.
I'm told that you are here on a study tour since the past week to learn how the Swachh Bharat mission, such dramatic success so quickly, and how it can be replicated in Nigeria. I sincerely wish you all success.